Hello and welcome to my presentation. My name is Candice Dobranovic and my PowerPoint is about reducing central line associated bloodstream infections in the oncology population. I have been working with the oncology population since I graduated nursing school. This population and providing excellent care to them has become a passion of mine. During my time on the oncology unit, I have seen many of my patients get central line infections. I believe as an oncology nurse, it is extremely important to help lower the risk of infections in this population, and I feel that my change project would do just that. First, I am going to start off by identifying the problem. My PICO question I came up with is, in oncology patients with a central line, how does the use of disinfectant caps compared to not using them affect the amount of central line associated bloodstream infections within the patient's stay? According to Isaac C., Allison Freefield, and Shelley Magel, bloodstream infections are estimated to occur in 10 to 25% of oncology patients. They are a substantial cause of serious morbidity in this patient population. The oncology patient population is at risk for infection due to chemotherapy. Chemotherapy causes neutropenia. When a patient is neutropenic, their immune system cannot fight off an infection. Infections in the oncology population could lead to a longer hospital stay, delay in their treatment plan, and possible death. The types of central lines that we use to administer chemotherapy are portacasts, PICCs, and CVC. Next, I will assess the problem. According to Keboich, Blair, Bell, Sun, Wong, Darling, Slenderman, Egan, and Sepkowitz, the pathogenesis of central line associated bloodstream infections commonly involves contamination of the catheter access port or hub. Frequent handling of the hub during catheter use make it vulnerable to injury by microorganisms. Nurses need to be educated on the techniques to reduce the risk of infection in the oncology population. Hospitals should have policies in place for handling central lines. Keboich, Blair, Sun, Wong, Dowling, Sinderman, Egan, and Sepkowitz wrote, "The Curos cap provides passive and continuous disinfection of the catheter hub without the need for manual scrubbing. Components claim that its use is time-saving, practical, and effective, and some studies have demonstrated a reduction in bacterial contamination of the catheter." The first literature review is about a study using disinfectant caps. The purpose of the study was to see the effect on compliance and incidence of vascular access device-related bacteria. Following the introduction of the passive disinfectant device for 6 months in 4 units of the hospital, they introduced the disinfectant caps to high-risk units, including oncology and ICU. The article found that the outcome before the introduction of the disinfectant caps, 54% of their staff were only cleaning the hub for 10 seconds or less. The central line associated bloodstream infection rates dropped 69% from 26 cases before the study to just 8. After the intervention, the study also showed that the hospital was saving money because of the decrease in infections. The second literature review showed the impact of routine use of a disinfectant cap for all central lines at reducing the risk for infection in oncology patients. The study was conducted on an oncology unit in a hospital in New York City. The disinfectant caps were used on all central lines and changed every 7 days. The outcome of the study showed that the use of disinfectant caps decreased central line associated bloodstream infections by 34%. The use of disinfectant caps also saved the hospital an annual savings of $3.2 million in direct medical costs. The third literature review showed the use of an antiseptic barrier cap reduces the amount of central line associated bloodstream infections. The researchers searched for research studies that researched the use of disinfectant caps at reducing the risk for development of central line associated bloodstream infections. 9 studies were included in the symptomatic review. The pooled IRR showed that the use of the disinfectant barrier cap was effective in reducing central line associated bloodstream infections. Adding the use of an antiseptic barrier cap is an intervention worth adding to central line maintenance bundles. Next, I will talk about the current practice we use for handling central lines on my oncology unit. When entering a central line, a aseptic technique must be used. When handling the hub must be scrubbed for 30 seconds. Dressing on central lines must be changed every 7 days. We change them on Sunday. The use of a barrier patch must be used and changed every 7 days. Needle changes for ports must be done every 7 days. Chlorhexidine and gluconate wipes must be used daily to bathe the patients with central lines. The goal of my change project is to prevent central line associated bloodstream infections in oncology patients by providing education to the staff and the use of disinfectant caps on all central lines. Now I will talk about the interventions with my change project. I started my change project by coming up with my PICO question and collecting evidence-based research about the use of disinfectant caps in reducing central line associated bloodstream infections. I asked my charge nurse Tanya to be my mentor in this project. After collecting all the data, I presented the data to my charge nurses and director of my unit, as well as the infection prevention team at the hospital. Once the use of the disinfectant caps was approved, I would inform the nursing staff of the change during our beginning shift huddles. After providing education and demonstrations of the use of the disinfectant caps, we would initiate the change project on the unit. I would have the charge nurses audit the use of the disinfectant caps and support the staff with the change. At the end of the project, I would evaluate the effectiveness of the disinfectant cap at reducing central line associated bloodstream infections in the oncology population. After starting the interventions, we can evaluate the effectiveness. We can ask, did the staff adhere to the use of disinfectant caps on all central lines? Did the use of the disinfectant caps reduce central line associated bloodstreams in the oncology population? Is the use of the disinfectant caps beneficial for the patients and the hospital? Answering these questions could help determine if the interventions are working and where change needs to occur. After a year of using the disinfectant caps on my unit, I would see how many central line infections we had and compare that with a year before we started using them. Who benefits from my change project? The patients benefit from my change project by using the disinfectant caps. The patients will have less hospital stays if they remain infection-free. They will be able to continue their treatment plan and finish on time. This will also help destroy the cancer if they can stay on track with their treatment plan, and their risk for death will decrease. The hospital would benefit from using the disinfectant caps as well. Reducing central line associated bloodstream infections save money for the hospital because insurance companies will not cover hospital acquired infections. This has been my change project. I hope you all enjoyed my presentation. Please let me know if you have any questions or comments. I'd be happy to answer them. Thank you for taking the time to listen to my project.